Have you ever been going about your day and suddenly felt a weird little lump on your knee and your mind just starts racing? Yeah, you're definitely not alone. So today we're going to pull back the curtain on knee cysts. We'll talk about what they are, why they show up, and, most importantly, what you can actually do about them. Let's dive in. It's such a common thing. Maybe you're out for a jog, or you're just getting up from a chair, and you feel this bulge, or maybe just a bit of tightness, especially behind your knee. And yeah, it can be a little alarming at first, but the good news is, more often than not, it's something totally manageable. So what exactly is this lump? Well, at its heart, a knee cyst is really just a little sac filled with trapped joint fluid. But here's the number one thing to get your head around. The cyst itself is almost never the real problem. Think of it like a warning light on your car's dashboard. It's not the engine, but it's telling you, hey, something's going on inside the knee joint that we need to check out. Okay, so let's start with the big one, the one you've probably heard of. It's called a popliteal cyst, but everyone just calls it a Baker's cyst. This is by far the most common type we run into. Now, the key to understanding a Baker's cyst is all about location, location, location. It shows up in a very specific place called the popliteal fossa, which is just the fancy medical term for that little hollow at the back of your knee. It's basically a small fluid sac that's already there, called a bursa, that's just gotten way too big.
So how does this actually happen? Well, imagine you've got something going on inside the knee joint, maybe some arthritis causing inflammation or a tear in your meniscus. The joint starts producing extra fluid to try and deal with it. All that extra fluid has to go somewhere, right? So it gets pushed to the back of the knee and finds its way into that bursa. And here's the kicker. The opening often acts like a one-way valve. Fluid can get in, but it can't get out. So it just keeps filling up and poof, you've got a cyst.
And what's really interesting is that a ton of Baker cysts cause no symptoms at all. People will have one for years and only find out about it when they get an MRI for something else entirely. But when you do feel them, it's usually that sense of tightness or maybe a dull ache. The one time it gets really dramatic is if the cyst ruptures. That can cause a sudden, sharp pain down in the calf, which can actually feel a lot like a blood clot or DVT, so it's definitely something to get checked out right away. Now, while Baker's cysts definitely get most of the spotlight, they are not the only game in town. So let's take a quick little tour of a few other types of cysts that can pop up around the knee. All right, next up we have the meniscal cyst. Now this one is different. A Baker's cyst is kind of an indirect result of a problem, but a meniscal cyst is directly connected to a tear in the meniscus. That critical C-shaped cartilage that acts as your knee's shock absorber. And this just perfectly illustrates that whole symptom, not the cause idea. The joint fluid literally leaks out through a tear, usually a specific kind called a horizontal tear, and forms a little lump right next to it. So finding one of these is like a giant flashing neon sign pointing directly to an underlying meniscal tear that really needs to be addressed. Okay, let's look at a couple of the rarer ones that are still really important to know about. Over on the left, you see a PTFJ cyst. That one forms at a joint on the outer side of the knee. And on the right, that's a ganglion cyst, which in this case has decided to grow right on the ACL, one of the most important ligaments for knee stability. And the main thing here is that location can make a huge difference. A PTFJ cyst, because of exactly where it is, can actually push on the peroneal nerve. And that's a big deal, because it can cause serious problems like weakness in your foot or even foot drop. Ganglion cysts are a little different. They actually come from the tissue itself breaking down. And while they're often just found by accident, they can definitely cause pain if they get big enough. All right, so we've met the whole family of cysts. The next big question is pretty obvious. What in the world do we do about them? Let's take a look at how doctors figure this out and manage them. Well, the very first step, always, is a proper investigation. You can't just guess what's going on. You really have to understand not just the cyst, but the entire landscape of what's happening inside that knee joint. And just so you know, the information we're going over today isn't just pulled out of thin air. It's based on a really thorough, systematic review of 31 high-quality clinical studies. So this is solid, evidence-based stuff. So doctors have a few different tools to figure things out. It all starts with a physical exam. Then there's ultrasound, which is fantastic. It's fast, it's cheap, and it's great for just confirming, yep, that's a sac of fluid. But the real heavyweight champion, the absolute gold standard, is the MRI. Why?
because an MRI doesn't just see the cyst, it gives you this incredibly detailed 3D picture of everything: the meniscus, the ligaments, the cartilage. It shows you the real problem that's causing the cyst to form in the first place.
When you get to treatment, there are really two main ways to think about it. The first approach is conservative care. This is all about managing the symptoms, draining the fluid out of the cyst, maybe using a steroid injection. The other path is surgery, which is about fixing the root cause. And that right there is the most important difference. If you only drain the cyst but don't fix the leaky pipe that's filling it up, guess what? That cyst is probably going to come right back.
And this number right here just shows you how incredibly effective that surgical approach is. When surgeons go in with modern arthroscopic tools and actually fix the problem inside the joint, the rate of a Baker cyst coming back plummets to just 3.1%. I mean, that is an amazing success rate and a huge leap from older methods. But what if we could do something even better than just managing symptoms or repairing damage? The future of treatment is really shifting towards this incredible new idea: helping the body actually heal itself from the inside out.
We're talking about biological treatments, like platelet-rich plasma or PRP. The idea is actually pretty simple, but it's incredibly powerful. You basically take a little bit of the patient's own blood, spin it down to concentrate all the amazing natural healing factors, and then inject that liquid gold right back into the knee to calm inflammation and kickstart tissue repair.
And this isn't science fiction. The early results are seriously promising. One clinical trial saw a 70% success rate using a combination of PRP and hyaluronic acid to treat people with degenerative knee problems. It just shows the incredible potential for treating the root cause without needing major surgery.
Okay, that was a lot of information, I know. So let's just boil it all down to the most important things you need to walk away with.
Okay, first and foremost, always remember, a knee cyst is a symptom, not the disease. It's a signpost. Second, an MRI is your best friend for diagnosis because it sees the whole story. Third, if you want to get rid of a cyst for good, you have to treat the reason it's there in the first place. And finally, keep an eye on what's next. These regenerative treatments are changing the game from simple repair to true healing. And you know, this quote from the study we've been looking at just says it all perfectly. There's no single right answer for everyone. It's all about getting a deep, thorough look at what's going on so you can create a custom-tailored plan that's going to work best for you. Which really leaves us with this incredible question to think about. For so long, medicine has been about cutting things out or repairing them, but we're now on the edge of a new era, an era of regeneration. The future might not be about getting new parts, but about helping our own bodies to rebuild and heal themselves. Pretty cool stuff. Thanks for tuning in.